Welcome to Thursday live session with me, Vinod James. Welcome to Neethus Academy Reading Live. How are you all today? Year just started and already day 4, isn't it? How quick time flies. But doesn't matter. Every time when we come in front of you, it's so much of a privilege to come in front of you, talk to you, and see how you're all getting benefited. So we've been, ever since the new year started, we told you that we are going to come and tell you certain things on the aspect how to improve certain aspects of what you are doing on a daily basis, isn't it? So what are we doing? First, we taught how to tackle your so-called part A in 8 minutes of time. Now it is about how you're gonna do or how to get the so-called 400, isn't it? That's an absolute, what can you say? What do you call cherry on top of the icing, isn't it? We all do a lot of hard work, and we would definitely want to reach that barrier. I would say try targeting 500. That's what yesterday I told you, the importance of having a focus on. Okay, Soni Raju, good afternoon. Savit Biju, good afternoon. A very, very, very good afternoon to all my lovely students. No matter whichever part of the world are you from, a very good morning, a very good afternoon, and a very good evening to all my lovely students. Now, always we look into the aspect of getting better on a daily basis. Revati Balakrishnan, good afternoon. So how are things? Okay, we have told you to do certain things. Now, the first and the foremost important thing in order to get a feedback on what we have told you, are you finding it beneficial? Okay, it's not just about, okay, do it in 8 minutes, do get the 400. It's not that. Are you benefiting out of what we have told you? So all my lovely students who are in front of me, would you be kind enough to comment on the aspect of how are you finding? So whatever that we have told you, are you all getting or reaping the benefit out of it? Ashley Joes, good afternoon. Are you all finding a bit of difference in what you do or how you get the scores? Savit, yes, okay, fair enough. Good enough. So again, please do not stop on a daily basis. It has to be on a continuous routine. Okay, it should be a routine to you. That's what is important. Okay. So please ensure that not only that you're doing just for 1 day or 2 days, it has to be a routine. Neethu Surendran, good afternoon. Subhi Ajit, good afternoon. So good to know that you are finding it better. Okay. So no matter whatever it happens, okay, you have to always understand the importance of how things can be benefiting you. What are the things that you should be doing and how to make things work for you. Okay. So you should always ensure that you are getting the benefit out of it. Okay, so as I could see, I just missed few. Maria, good afternoon. Athira, good afternoon. Diana, good afternoon. Clarina, good afternoon. Jesna, good afternoon. Joyce Nobin, good afternoon. Shiba Babu, hi sir, hi. So we have just pinned the official Neethus Academy few social media platforms. We have the WhatsApp channel. There we have 2 Telegram pages. Now, why I keep on emphasizing the 2 Telegram pages? Please understand, you might be contacted by a lot of fraudulent people saying that Neethus Academy has that, Neethus Academy has this. Whatever that we have, we will come straight to you. We have nothing to hide in front of you. Whatever that we want to say, we'll come straight in front of you. And if you want any clarification, there's a number which is scrolled on the screen. You can contact that particular number only, no any other numbers. Okay. Anita, good afternoon. Sobi, good morning. Kalamani, good afternoon. Renita, good afternoon. Chittu, good afternoon. Anita Prabhu, good afternoon. Aina Rajneesh, good afternoon. After some time, Aina. Right. So I was just asking, whatever that things that we have told you, okay, of 8-minute barrier and 400. Are you all doing it? How are you feeling? Are you feeling a bit better? Or are you finding any significant impact on what we have told? Please do give us a feedback onto it. Jaya Arjunan, good afternoon. Joby, good afternoon. Anumol Babu, good afternoon. Regina, good afternoon. Georgie Johnson, good afternoon. So nice to see a lot of new names. And on top of that, as I've mentioned, do let me know, are you finding it better? And on top of that, if there is anyone who is attending the live for the very first time, please do let me know that you're attending for the first time and where you are attending from. Okay, that where is very important to be that catalyst for all our students, because you should always know that you are attending an international class. Why international class? You are from different, thank you 𝐿𝐶𝐵. 𝐿𝐶𝐵 is from Qatar. So she always comes up saying that 𝐿𝐶𝐵, I'm from Qatar, which is quite helpful for us. Why? We can remember, when you repeat the whole thing, the same name and keep on saying, that is how it goes to our long-term memory. Darshini Selva, good afternoon. So this is what I'm just going to talk about in order to reach that 400. Okay, I just mentioned what is the next strategy that you're going to do. Repetition is the mother of learning. Srirag, I'm from UAE, if I'm attending for the first time. Thank you very much, Srirag. Shiba Babu, I'm attending from UK first time. Shiba, you're very lucky because you're already there in most of your dream country, isn't it? Ria Santosh, good afternoon. Joyce Inobin, I'm from UK. So today UK people are more, is it? See, this is how lovely, because few days back there were people from Malta, which was more. Then we had people, yesterday I think we had people more from Saudi. Today we have people more from UK, isn't it? So it should also say, see, there are a lot of people from where I am from, UK. Okay, tomorrow let's see where are people from. Priya Rakwell, after some time. Priya, good enough. Good afternoon. So when you're doing thing, now I just told you, I gave you a clue on the aspect of what is today's thing on the aspect of getting to that 400 barrier. See, 400 barrier, in order to do that, you have to do a lot of repetition. See, now why repetition? See, we always say repetition is the mother of learning. Claudine Lewis, good afternoon. And also I would definitely request, if you have not yet liked our page, if you have not yet followed our page, if you have not yet subscribed to our channel, please do the same, because that shows your support towards us. Okay, because you can see that if you really look into the Telegram page, we have about close to 50,000 students now. Okay, because this is active students, okay, not the students. If at all our students would have been there who have already reached their dream destination, it would have closed about 2 lakh people, a minimum. Okay, these are all actively participating on the present. Okay, that's why. And if you really look into the page that you're watching, we are always, every day, the likes are improving, the follow buttons are improving, the followers are improving. So thanks to all of you who are making it happening for us. Asha Sebin, good afternoon. Akila Sham, good afternoon. So this is how you grow. Now the next thing is about the importance of repetition. Okay, and its importance of getting into that 400 barrier. Today, I'm going to talk about the importance of repetition and the importance of spelling. See, generally, okay, students, when you are correcting yourself, okay, you don't give that importance to spelling mistakes. Okay, Betsy, good afternoon. Now, why spelling mistake plays a pivotal role? Because there you have another student from UK as well, Jesnamol from UK. So today, a lot of British people in front of me. Is it Kavita Balaji? Good afternoon. Fair enough, happy. So why that spelling is important? See, you talk about 42 questions, isn't it? And in that 42 questions, 22 questions are okay, safe. Why? It is only you're going to bubble the appropriate letter. This is where that 400 is going to happen, okay? The 22 questions, how you bubble. See, no matter whatever you tell the student, they don't realize it. Okay? See, few students simply put a tick mark. They simply put a small point there as when you're practicing, because they are not thinking on the aspect of what is the purpose of me attending a class, what is the purpose of me doing a material. Good afternoon. 𝐼𝐡𝐚𝐬𝐬𝐬𝐬𝐬𝐬 Patel, is it? Hope I read your name proper, okay? Quite bad with reading. Hindi, okay? Good afternoon. Smita Binish, good afternoon. Neethu Lipson, good afternoon. Shanita Sabu, good afternoon. So now see, when you do what you're going to do, see, when you put this small point, mark, tick mark and all, please understand, what you practice is what you're going to do on the day of exam, because you're going to be of a bit of exam stress, isn't it? Even though if I ask you, how many of you have a habit of getting tensed on the day of exam? Is there anybody who gets that? Lisha Jose, good afternoon. Is there anybody who has exam fever? Yes? Gloria Abraham, good afternoon. Anybody who have exam fever, tell me. I can see a few thumbs up popping up. Jinsi Jose, good afternoon. Maria have. See, now why I always adore people who have that courage to say the first. See, why? That first step is what you have to take. Aina has, Ivira has, Bensi Justin, I have, Ashley I have, Soumya, good afternoon, Subi Ajit I have. So what happens is, Jijo Thomas, hi, Lisa Jose, yes. So now see, Joyce Nobin I have. Now see, would you ever realize, Kavita, yes I have, Babita, yes I have. See, when you do have this fear, okay, Gigi Thomas I have, on the day of exam, do you think that you're going to do something different than what you have practiced? You wouldn't even remember, because your brain automatically does what you have done. So, Rashna Suraj, good afternoon. Jinsi, I have understood. So, the reason why you are being forced with us is to make sure that what you do on the day, Jeffy Andrews, good afternoon, is what or how you're going to do when you are stressed. Because your brain automatically does what you have practiced. So when you have practiced only tick or point, and with on top of the stress on there, you're simply going to put that tick. Do you think that that tick is going to give you the mark? No. But you wouldn't realize it, isn't it? Now what happens? You would say, oh, that answer is right, this answer is right, this answer is right. So I'm expecting 450. But in absolute reality, yes, maybe 16 out of 16 is right answer. But will you get mark when you put tick mark? No. So what happened? You start getting dejected with whatever that you have achieved, isn't it? You would feel, oh, I did a lot of things and these people are not giving me the mark. Is that people not giving us the mark? No. It's what we have done wrong. We never want to blame or see, generally, as far as I know, when you meet a lot of students, see, I have belted it down. Let's say speaking, or let's say I'm not talking anything about one particular exam. There are a few other trainings that I give. So there also I belted it down. But what happened? Score, it's not there. Why? That person didn't like me. It's not the person. See, it's about that, because what you practice is what you're going to do on that day. So my today's suggestion to all of you is, when you are being told to do certain things certain way, okay, when you are told, see, you are supposed to write the answers in that blank, you are expected to do that. Understood? So if you are asked to bubble the appropriate letter, please do bubble the letter when you're practicing, whether it is in the class or when you are doing as homework. Do as one unique way, the most appropriate way that you have to do. Understood? That is one. Okay. Two, when you go to part A of it, students doesn't even realize when you are correcting on your own. Let's say the answer to a question is injection. okay, without an S. But in the text, let's say it is showing about injections or something like that. So in the text, it is injections, but you are writing injection. Okay, and then the next word is R. So injection R, will it come? It doesn't come. Injections are. Now you wouldn't add that S. Maybe literally with the quickness or with the management of time and all, you were a bit reluctant to write that S. But when you correct it, let's say when you correct it, what happens is, injection, I know, I just missed that S. Is it going to be of any benefit? No. See, this is where you have to start. Even when you are evaluating your answers, tell someone else to evaluate your answers for. So that if that S is not there, they will put it wrong. Then you would know the difference. See, you expect 40, but you might get 30. Why? 10 spelling mistakes. Now, this is a grave mistake that we all do when you're doing reading. See, reading is a module where the spelling is given, the answer is given, everything is given. But what do? You simply write a wrong spelling. We are like that. There are certain things that we need to look forward in order to change certain perspectives. So you have to have an open approach. When the spelling is wrong, you should know, okay, please mark it wrong. There are students who put 2,5 mg. Wrong. If you have to put the decimal, you put the decimal there. If you haven't put the decimal, mark it wrong. If you haven't given a hyphenated word a hyphen, mark it wrong. See, you have to come learn the toughest way, not the easiest way. Anu, good afternoon. Understood. Now, these are what is the limiting factor, or these are the limiting factors that is going to hinder you from reaching 400. It's not that you don't have the talent. How you deal with it is a problem. So today, the important thing that I was talking about was two things. It's about practicing how it has to be done, and then the way that you correct. The way that you do are the two most important thing that is refraining you from reaching that barrier. If you start focusing on this, let's say we are practicing. See, we're not taking the exam. As when you practice, you do it the hard way. Mark my words, 400 is not at all a problem. Clear? Shiny V, yes, good afternoon. Was it something new that what I told you? Manju Matthew, good afternoon. Was it better? Did you understand? Was it of any benefit to you? If so, please do let me know. Because we always believe, as I've always told, with you, your insights is how we grow. So please be kind enough to tell me, what are the two important points that we always give least importance in our life? Because repetition. See, I always remember when I was doing my language training, my faculty member used to, see, first he said, okay, this is wrong. Okay, I just left it like that. Second time, when I was writing an essay, he said, marked the same and told me to write 10 times. I absolutely adore. Why? Repetition. When you repeat that word 10 times, you would never forget. But even after that, let's say you make the same mistake, you make that 10 to 25. That's called the power of imprecision. Now, those two words that I have written, I will never make a mistake in my life. Jilmi, yes. Okay, Jaya felt, at least two people felt that they were benefited out of what it is. So please try to do. See, the important thing is about how you do. Clear? Reni Chako, good afternoon. Right. So now let's go back to the things that we are here for. We'll be doing two things. And Neethus Academy, as you can see, just a thing. Our next batch, Feb, March, April, is going to be closed soon. So if you think that you need a professional approach, please do join. If not, we'll be going into the next thing. So part B is what we'll be doing first. The material will be shown on the screen. You'll be having a 2 minutes time. Please do that and do it within the time. And as soon as you finish or find an answer, just put a message saying that done or put a thumbs up. That's all what I need. Okay, don't write the answer. We will discuss. There you have the material on the screen. Please do the material and then we will discuss. Okay. Margaret, good afternoon. Anita Prabhu was the first one to say done. Sanita Sabu done. Divya Jish, good afternoon. A very, very, very good afternoon to all of you. Though late, always welcome. Shibianto done. Good enough. All of you have done? All of you got an answer? Ivira done. Sobi done. Shiny done. See, I'd love to see at least one icon next to you. I've seen a lot of flags, heart shape, love, a face shared. So if you feel that my classes are beneficial, please do not hesitate to share on your very same social media platform. Renita done, Maria done, Jaya done, Hema done, Jinsi done, Joycey done, Subi done. Excellent, excellent. Soumya done. Good enough, good enough. A lot of response. I love when students respond because that's the only way where we can communicate, isn't it? Soumya, Savit done, Kavita done, Christina done, Akila done. Good enough, good enough. Priya Rakwell done. Jesna Jojo done. Revati done. Sabita, hi. Jijo done. Good enough. Chittu done. Good. Now, would you be kind enough to tell me what is your answer and where you got that answer from? So that what is important, of course, let it be A, B, C, where you got that answer. That where is very important for us to correct, because I always believe to correct from where, if at all you went wrong, from where you went wrong. That's how it is. Muniyasami, good evening. Ayana, done. Ashley, A from last. Okay. Shiny, A from second line. Fair enough. Aina, A from first part. Sharanya Sunish, good evening. Good enough. So, Jijo Thomas, A. Ivira, A in the first para. Anita Prabhu, I got A from the supporting sentence. Sobi, C from middle part. Okay, so it's between A and C now. Soumya Joseph, A from the first two sentences. Savit Biju, A from the first part. Munia Sami, C from last line. Okay. Sheena Biju, A from the first three lines. Sheba Babu, A from the first part. Sanita Sabu, A from the first part. Reni, A from the first part. Shibi, A from last to first line. Atirasali, C. Uttam Kumar, good afternoon, after a long time. A from first part. Rinita, C. Jinsi, C. Shilpa John, B. Now am I happy? All A, B, C are there. First sentence itself, Jijo, okay, fair enough. Akila Sham, C. Subiyajit, C. Chittu, C. Okay, fair enough. Hema Koshi, C. Good. Right. So I think I'm not saying all of you have commented, but whoever are here to make a difference. I always believe a person who can comment, come in front of all the public and say, this is my answer. That's where that thing is, isn't it? I'm here with a purpose. I'm here to make a difference in my life. So Jilmi, C from middle. Okay, fair enough. Now let's have the material on the screen and then we will say how to deal with it. Let it be A, let it be B, let it be C. It doesn't matter. Because you always have to remember when you're doing part B, first and the foremost important, read the question. As you read the question, understand the question and underline the question. Very, very, very important. And you, in part B especially, you are to relate it with the question. Now I'm just going to show you why it is. See, the question in here is clearly saying priority. See, something which is important, priority. So what is the main thing that you are expected to do during physical examination, and it should be given to what? So priority is given to what? Okay, so those are my two keywords. Now, after this, you are always at the liberty to do whatever you like to do. When you want to read the paragraph and then pick an answer, you can do that. But I'm a person who always want to know what I'm searching for in the paragraph. So what my strategy is, I read my answer option, underline the keywords in the answer option, then I pick it up from the paragraph. Either way, it is fine. So now why I say it is, you must read along with the sentences. Priority must be given to informed consent. Okay? Or priority must be given to appropriate length of the test. Sorry, not appropriate. So length of the test or appropriate length can be the keyword. Priority must be given to full comfort experience or comfort experienced by them. Now, informed consent, appropriate length, comfort experience. Now I'm going to read my paragraph. Sexual boundaries in the doctor-patient relationship. So this is definitely to have where is that boundary where it should be kept or maintained between doctor and the patient. So best practice during consultation, physical examination. Definitely it is during physical examination. Reading. You should only conduct a physical examination if it is clinically warranted. Okay, so if it is really necessary, then you should do. And what you should be obtaining? You should obtain the patient consent before conducting a physical examination. Okay. Now, you must also obtain a consent prior to the start of the consultation if an observer or a chaperone is a bystander, attends the consultation. Then they are saying making sure the patient is aware that they should have or they should voice any feelings of discomfort or pain, and they can ask you to stop the examination at any time. Okay. Now, I forgot to mention what is a strategy. Strategy is called elimination. So, throughout, as of what I have read, I can see that it is about getting the consent of the patient. Let's see. If the consultation involves physical examination that requires the patient to remove their dress, you should provide an appropriate place to undress. This is an area where the patient can undress in private, out of view of anyone, including you. Whether you are present there, you should give a patient, see, please go to one particular place where it is absolutely private for that particular patient. Okay. Then you should not require, see, again they are saying you should not require a patient to undress unnecessarily or stay undressed for unnecessary length of time. It's not appropriate. For example, the patient only needs to uncover the part of the body that has been examined. See, whatever or wherever that you are going to examine, that particular place is only what you have to ask the patient to undress, and you should be allowed to cover it again. See, once that examination is done, you should have asked them to cover it. When another person is present during the consultation, you and your patient may want any other patient, another person present during a consult. So that is nothing to do. Now let's see how to eliminate. Okay, as I mentioned, see, it's all talking about the informed consent. That means you are going to inform the patient this is what you're going to do, and this is where you have to get the information during the examination. Appropriate length of the test. There is nowhere that saying that is about priority to give. Okay, my checking would be about 5 minutes in the. No, it is not mentioned. So the people who have got B, it is not there. Okay. Now see, full comfort experience, this is not at all about the comfort or full comfort experience. See, they are saying the only thing is they should be given on the aspect. See, make sure that the patient is aware. See, there are discomfort or pain. That is not about the comfort experience. That means the ease that is experienced during physical examination. That is what the comfort is. So this is to tell the patient, see, when I do a physical examination, that if at all you feel any pain or any discomfort that you feel, you can tell me. You have the authority to raise your thing saying that, yes, see, please understand, I am having a pain. Oops, it is paining for me. You have the right. So again, that is talking about the consent to the patient. It's not about the comfort experience. Comfort means the, what can you say? They have been provided with a air-conditioned room. They've been provided with a nice couch where they can sit and relax. They've been given a cushion. Those are called comfort experience. Okay? So that full comfort experience is not mentioned, and that is not the priority to be given. See, if the comfort, then there should not be any pain. Understood? So this is where, see, when the patient is not, it's to undress it. That's not about comfort experience. Do you think that it is comfortable for the patient to remove everything in front of someone? No, it's not necessary. Okay? So it is not about, the priority must be given to the full comfort. It is not about full comfort. Full comfort means absolute ease for the patient. Not there. See, and let's say the patient have to have a bystander next to the patient, and the patient is undressing. It's not as comfortable as it is, isn't it? So you have to understand it is not about full comfort experience. So C is also wrong answer. So congratulations for all the people who have got it. A, and this is how you are going to mark. See, again, please understand, just to make sure that it is all visible for all of you. You are going to bubble the appropriate letter. Please ensure that you are doing this on the day when you are practicing, no matter when. Don't put tick mark, wrong. Don't underline it, wrong. Don't highlight it, wrong. Okay? Good enough. So, yes, Kavita Balaji is dancing. So be clear. Kalamani Shankar, thank you. Renita clear. Priya Rakwell clear. Soumya Joseph clear. Westnag dancing. Good enough, good enough. Keep on dancing, isn't it? Why not? Achievement are always to be cherished. So any doubts with the thing that I've told you? Anything that you're not sure about? Anything that you want me to clarify? Anything like that? No. Fair enough. Now let's go to getting the 500 out of 5. That means part A, the basic, fundamental thing. Alvira, happy. Okay. Good enough. Jijo, clear, and thank you. Pleasure. So are you all ready for today's part A? Again, I'm going to tell the name of it. It is colporaphy. 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 Okay, that's how you pronounce. Now, not that I have told the name of the material, I want you to tell me how you felt about today's material and how much time did you take to complete the today's material. That's the most important thing. I've just shifted. This new year, I'm not going to ask you what is the material. I'm going to tell the name of the material. I want you to tell me How was the material and how much time did you take to complete it? Tell me, how much time you took in order to complete the very same material? Where did you get that? Give me an insight, because we would definitely love to hear from all of you. Why? Because after hearing from you, that's how the next designing of the next day's material happens. So please be kind enough to give us a review on the aspect, how you felt about today's material and how much time were you able to complete it. Tell me. Soumya, little tricky for me. 15 minutes, Soumya? Okay, fair enough. So little tricky. So the first tricky Akila, 13 minutes. Okay, fair enough. Shiba, little difficult, 20 to 25 minutes. Okay, fair enough. I always love those students who have that ability to tell what is happening with them. Truth in front of all. Good enough. Savit, tricky, 13 minutes. Jilmi, 20 minutes. Okay, fair enough. Renita, difficult, 15 minutes. Okay, fair enough. So generally it's a bit difficult because you were the one who was saying, now it is all easy. Tricky material, 15 minutes, very tricky. Still not done, but I usually complete part A in 13 minutes. Bira, I would definitely tell you, if you have not done the material, I would definitely tell you to skip, do the material and then listen to the answers. Because if you listen to the answers, then that material is a waste free. Sanita, 20 minutes, sir. Okay, fair enough. Joyce, 18 minutes. Kavita, tricky, 15 minutes. Fair enough. Maria, 20 minutes, tricky. Okay, good enough. So generally it's a bit tricky, is it? See, generally, to be very precise, okay? How many of you, I'll just show you why this kind of mentality difference happens, okay? It's just purely mentality difference. Because you all have the innate ability to get this done and dusted. How many of you knew this procedure before? How many of you have heard about this procedure or knew this procedure before the material was there in front of you? How many of you knew this? Because when I went to, it was quite difficult. First and the foremost important thing is it was a bit challenging for me to even pronounce the name properly. Because that was a bit new topic to me. Okay, so when the topic is something which we are not sure or which you have not heard about, we take a bit more of cautious approach. And that is why it is happening. See, if your fundamentals are right, come what may, come whatever the material, if your strategy is right, you don't have to worry about it. I'll show you why. See, 15 minutes, 20 questions. Strategies, skimming and scanning. Why I keep on repeating? Because that is why I always tell repetition is the mother of learning. Scanning, you know, skimming, quick look. What are you to do? You're going to underline the keywords. You have 4 texts, 1 common theme. Text A, text B, text C, text D. You should quickly go through. That's called skimming. What are the things that you have to underline? You always have to remember. It should come to you by heart. You should know. I'm just going to show you. See, 𝐴𝐵𝐺 is a surgery that fixes the weakness of the vaginal wall. The treatment is a pelvic organ. That's POP. POP is an organ of droop and some muscle and tissue. And the vagina will become too weak to hold the organs in place. 𝐴𝐵𝐺 strengthens the tissue muscles and muscle support in the pelvic organ like the bladder and the rectum. There are 2 types of 𝐴𝐵𝐺. What is that? Anterior 𝐴𝐵𝐺, which is tighten the muscle in front of the wall, and the posterior one, which is tighten the muscle in the back of the wall. So one is in the front, one is in the back. So what do I understand in text A? What is 𝐴𝐵𝐺? Where it is affecting? What are the organs which are affected? What are the 2 types? Now likewise, once you are in the comfortable position, this is during the procedure, isn't it? So administer general anesthesia, widen the vagina, speculum. Likewise, okay, during this, it takes about 30 minutes and its needs, it depends on, it may take longer. So text C is about a study. So anything with relate to study. Chibi, thank you so much for the love and the flowers. Very kind enough. Text D, side effects and complications. So anything which talk about the side effect, where are you going to go? Go to text D. You should know what is the difference between each text. Understand? So not just about frantically searching. As when you skim, you should know what are the differences between each text. After this, you go to question. So first part A, don't read the question, go to the Text first. 20 questions, 3 types. You should know what is the difference of 3 types and what are the numbers that has, what are the instructions. So 1 to 7, match the following question. The instruction says A, B, C, D, and you may use any of these letters more than once. Now see what is the importance of keywords, okay? See, what criteria led to the exclusion of specific individuals in the study? Where is the study? Do you need a second thought? Do you need to even check? No needed. I'm saying see. Now see, prevalent aberrations. Okay, the aberrations are abnormalities encountered in the individual post 𝐻𝐂𝐴𝐵. So, problems, contraindications, D. Generally, this is how you should look into. Understand how important it is. You are trying to waste a lot of time searching whether it is absolutely there. This is why skimming gives you a lot of insights. So, variables that contributes, that means factors that contributes to the temporal duration and the completion of surgery. So where are they talking about completion of surgery? During surgery, isn't it? During surgery is B. Now let's see if it is wrong or not. Where are they talking? See, surgery may take as little 30 minutes, but it may take longer if the area is. So factors that is there depending on the area. So B. What condition is typically addressed to the utilization of pulper? Condition. That means it should definitely have something to. What is a condition? Conditions are mentioned in A. If your vaginal wall becomes too weak, that is what it is going to address. So answer is A. See, what indicative signs, I love that. Instead of simply asking you what are the symptoms, what indicative signs manifest, that means begins the assimilation of sutures. That means what are the signs that say assimilation means acceptance of sutures, or what you can say, the absorbing of sutures. It is there in D, because it clearly says, you may notice a creamy vaginal discharge for a few weeks following a surgery. The discharge is a sign that your body is absorbing sutures. Done. What advantages occur or accrue from the implementation of? So what are the benefits? That's it. With this, simply we just change it. So benefits are mentioned only in A. Why? Because it can tighten, or what you can say, it can rectify, or it can strengthen. Where do you get that? You get that here. That's it. Answer is A. The instrument employed for the collection of urine during surgical procedures. So instrument, where are they talking about? During surgery should be, isn't it? Yes or no? So yes. So during surgery is mentioned in B. Where is the instrument? Administer. Then what happened? Your regional says here, and insert a bladder catheter to catch your pee during the procedure. That is it. So the answers are done. Now the next set of questions, these are called short answer question, where the instructions you have to by heart it. It can be as simple as that of a word or a short phrase. That means the answer can be anything between 2 to 3 words. Number or numbers or both. That means word or a number. This should be by hearted. I can see a lot of 7 out of 7. Absolutely good enough for people. Anita, Sanita, Akila, Renita, Soumya. Excellent. Very, very, very good. Keep it up. Sheba, 7 out of 7. Absolutely stunning. Maria, 7. Good. An alternative term for anterior called paraphy. Aina, 6. Fair enough. So alternative name means another terminology or the name. So anterior called paraphy is there. So what is that? Cystocele repair. So CYSTOCELEREPAIR. Joycey 7, Neethu 7, absolutely good enough. Revati 6. So the next sentence, next question. A medical apparatus employed in the dilation of the vaginal wall. Dilation, that means facilitated to encumbered examination. So that means they're clearly saying, what is the apparatus? A device used to broaden the vaginal wall to have a carefree examination, that is unencumbered. That means no disturbance. So what is the apparatus? Apparatus should be during surgery. So what is that? They use a tool called a speculum so that it is easier to inspect your wall. SPECULUM. Good enough. What precipitated the exclusion of the participant, marking the initiation of the specific medical condition? So this should be down somewhere in C, isn't it? Something to do with C. Now let's see. What is the thing that have triggered? So they have said one patient was taken out of the study because of the bladder injury, because it is asking you that only, because precipitate the marking the specification of the medical condition. What is the medical condition there? It's all mentioned. So bladder injury. 𝐵LADDERINJURY. The minimum time required for the completion of the procedure. Definitely during the procedure it says it takes as little as 30 minutes. So the minimum duration 30 minutes. 𝐷𝐵₁. Now this is what I love about this question. What percentage of people is in the randomization underwent the anterior colporrhaphy? So what percentage? So definitely go to C. So anterior colporrhaphy is there. What percentage? 50.9. The answer should be written as 50.9% should be the answer. Because if you don't write the percent, this doesn't convey any meaning, because 50.9 is a number. Understood? So it has to be written 50.9%. Now next question. In what medical scenario do the internal organs with the pelvic region undergo a descent? A descent. I love that word. Descent. What is descent? What do you mean by descent? Weak or something to show that. Okay. So where are they going to talk about? What are the medical condition that goes? So in vaginal wall, it is to treat the pelvic organ prolapse. So POP is an answer which you can write, because it drops because of the supporting muscles and tissue. So with POP, pelvic organ prolapse. PELVICORGANPROLAPSE. But the safest bet is, because they have given you the abbreviation, please write POP as well. No problem. Now, what complication arises post causing difficulty in complete bladder voiding? Voiding means emptying the bladder. Okay, so where are they talking about? It should be there in D, because it is one of the complications, isn't it? So where are they talking about any emptying and all those things? It is clearly saying you may have trouble emptying your bladder completely. What is that called? Urinary retention for a few days following surgery. So URINARYRETENTION. Now for the final set of questions, these are called fill in the blanks question, where the instruction remain as similar as that of short answer question, but here redundancy plays a pivotal key. You're not supposed to repeat if it is mentioned in the question. So only dash individuals remain, 3 years analysis and 10 participants. So definitely C. Go to C. So where are they talking about? 3 years. 3 years is there. 36 months. 10 participants dropped. 12 months of time. So what is that? Out of were available. So not out of 78. So 68 were available for 3 years. So the answer is 68, not 82. Okay. For 3 years of analysis. 82 is for 3 months. Is that 3 months or 3 years? Look at the question. 3 year. So the answer is 68, not 78. Okay, remain for 3 years. How many people were there? 68. This is why you're not referring to keywords. A persistent post-surgery suggests a gradual assimilation of sutures on patient body. So persistent. So we have already gone through that. The answer is creamy vaginal discharge. So CREAMYVAGINALDISCHARGE is the answer. Now, the health provider will execute a dash to unveil the musculature and sutures with vaginal canal. So what are they talking about? the health professional should do? Somewhere in B, isn't it? So where are they saying? The health professional may make a vertical cut or incision to expose the muscle in the vaginal canal. So vertical, V-E-R-T-I-C-A-L is the answer. Now in dash, meticulously incise superior and posterior walls to gain access debilitated segment to the vaginal wall. So what are they saying? So this is definitely out of two things. So tightening muscles and all those things are there. Yes. Is it there? Not there. Now where are the next keywords saying? So here also it is there. So make small precise cut along with the top of your vagina, back of the wall. So what is that? It is your anterior 𝐴𝐿 So ANTERIORCOLPORRHAPHY is the answer. Despite 4 patients deviating from 2 among them adhered to protocol completing the required documentation. So 4 patients, 2 patients go to C. Where are they talking about 4 patients? 4 patients is there, 2 patients also there. So what is that? They adhere to the study protocol. STUDYPROTOCOL is the answer. The ultimate question for today. Dash and dash are the structures that get support from this particular and reinforces the muscle in the vaginal wall. So definitely A. What are the two? Bladder and rectum. BLADDERRECTUM. I have wrapped my 20. It is high time that you start telling me what are your total scores. Or if you have any doubts, please do clarify. Let me see how many of you have, what are the scores? Or how much do you have? Or if there is any doubts. Maria, absolutely good enough. 19, good enough, good enough. You said tricky and you're scoring 19. Sanita, 17, good enough, keep it up. Shiba, 18, good enough, keep it up. Anita, 18, good enough, keep it up. Aina, 17, good enough. Renita, 17, good enough, keep it up. Soumya, 16, good enough. Akila, 18, good enough. Right. I don't know. That is the only few which I've got. So I don't see any. But Joyce, 15. Do not worry. I love those students who have the capability to say in front of public, I got this. Jinsi, 14. Absolutely good enough. See, go back and see why you made that mistake. Okay, that's called learning. There are few spelling mistakes that you would have made where you haven't referred properly. 18th question, what is the thing? See, make precise cuts. Okay, so where are they taking that they will make precise cut? Make small precise cut along the top of the vaginal wall. Which procedure? It is your anterior, isn't it? Because the other one, posterior, is back of the wall. That is why. See, we just paraphrased it. We just used a lot of synonymous language there. That's all. Just to make sure that you're getting exposed to a lot of vocabulary. So what are they saying? Meticulously incise. That means precise, incise, superior and posterior walls. See, posterior walls where gain access to the debilitating segment of the vaginal. So it is anterior. That particular method is only asked. Okay, good enough. We just gave you a bit of vocabulary. That's all. We just pumped in a bit of vocabulary. That's it. Neethu, 18. Good enough. Clear, Maria? So the absolute, if you really paraphrase it, for anterior, make precise cut on the top of your vaginal wall and the back of your vaginal wall to be accessed. Weekend of your vaginal wall. So that is, back of the wall is posterior. But what is the make for anterior? You make it in the front, isn't it? The other one is in the back. Fair enough. So because you don't have any doubts and all, I know that you're all clear about what it is. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. See you tomorrow.